Good afternoon.
Good afternoon.
Good afternoon, sir.
Good afternoon.
Good afternoon.
Yeah, good afternoon.
Good afternoon, sir.
Good afternoon. You start? Yeah. Good afternoon. Hi, everyone. On occasion of World Liver Health Day, today I thought I would just share few of my thoughts and give you some tips about how to take care of your liver and stay healthy for rest of your life. Liver is a very patient organ. You know, it doesn't show any symptoms at all up to a certain point. And that is why whenever somebody gets diagnosed with a liver disease, it's always in the end stage or a late stage. And that is why all the hepatologists or liver specialists around the globe, we advocate for early checkup so that we'll be able to pick up any kind of liver issues earlier part of the day. And a very common question is about alcohol. And we always stress that, alcohol and liver has a very strong bond that the excess alcohol always damages. We all aware of it and still we don't pay much attention of how much we drink every day or per week and something like that. And a lot of questions has been thrown upon all liver specialists that what is a safe limit for drinking? How much can I drink per day? What is an amount recommended per week? Whether it's different for a male and a female. I would like to clarify those doubts today. See, globally, everybody is now uniformly has said, and all the publications said that there's no safe limit mentioned for alcohol anywhere in any of the literature. So whatever has been said and done has been withdrawn, and now people have come to a conclusion that we cannot recommend such limitations for alcohol because any amount of alcohol has serious and deleterious effect on the liver itself. And but still we can't stop people from drinking occasionally. So that's why these guidelines which came in early 2000 for different countries it's very different. For example, Australia it's different, Austria it's different, in UK it's different, in US it's different, and India we don't have such criteria at all. So there is no point in telling somebody that okay, 20 grams per day is allowed, 100 grams per day is allowed, and zero tolerance for alcohol is being now advocated in different health platforms, saying that a drop of alcohol can lead to serious effects, and nobody should recommend such kind of recommendations when it comes to drinking. And we are very clear on one front when everybody uniformly agrees that there is no any good benefits of alcohol. Previously, people were saying drinking wine can help to reduce the coronary disease. And second is alcohol can give you a good sleep. And third is alcohol is good for your skin, because some people think that, red wine can give you a good shine and bright skin, which is totally false. It's all a myth. No, alcohol actually spoils your sleep. When you have a very tiring day, when you have a very long day, you think that, maybe a couple of drinks can help you to put sleep. But whenever you have alcohol, it actually disturbs your REM sleep. Your REM sleep is very important for you to have a good sound sleep. And any kind of this anxiety or sleeping pills or alcohol will disturb the REM sleep, and you won't feel fresh next day in the morning. And that's why we don't recommend alcohol for anybody at all. And if at all you're concerned that, your drinking habit is way too more and you're taking excess of alcohol every day and you're feeling guilty about it, you should go and consult your hepatologist or your liver specialist nearby area. You should get it yourself checked. And 90% of the time, your blood reports will be normal. But doesn't mean that, your liver is absolutely safe. So what should be done? Your ultrasound also cannot pick up precisely what kind of liver damage has been done. So what we liver specialists recommend is to do a fibroscan to see what exactly the quantity of fat in the liver. And second is the fibrosis stage. The liver will get stiffened. That's the second part of liver damage. That's why we need a fibroscan to assess the stiffness, whether it is soft or stiff, and what is the approximate amount of fat in the liver, which your ultrasound cannot precisely tell you, or even a CT scan cannot tell. And what are the stages of alcoholic liver disease or any kind of liver? It all starts with the fatty liver. That is stage one. And second is it goes to hepatitis, where the liver enzymes will be more because of the excess fat deposit. And third is the fibrosis, where the liver starts getting stiffened. The softness of the liver, the elasticity of the liver gets compromised. And that is when your score, fibrosis score gets high. And the final stage is liver cirrhosis. So when you have liver cirrhosis, then ultimately everyone needs to get a liver transplant. So it can vary from a fatty liver to a liver cirrhosis. It's a wide spectrum, and it doesn't happen overnight. It always takes a long time for you to develop a fatty liver and to reach. It always takes few years from a fatty liver stage to a cirrhotic stage. But how do we know is when you suspect yourself that your drinking habits are way too more and out of control, that is when you need to get these tests done. And if you ask me how far it is treatable in an early stage, of course, fatty liver is 100% reversible. Any kind of fatty liver, grade 3, grade 4 is 100% reversible. That is why we need to screen people who are at a high risk, like, people who are obese, people who have diabetes long term. All diabetic patients should have a fibroscan to protect the liver, because we see a lot of diabetic patients with the moderate obesity or even overweight patients and unhealthy lifestyles coming up with liver cirrhosis. And these patients absolutely don't have any kind of drinking habits in their life, but still, the patients are very, saddened, or they're very depressed that, without consuming alcohol, they end up in cirrhosis and then end up in a transplant. I mean, I understand from their point of view, but drinking alcohol doesn't mean that, I mean, without drinking alcohol doesn't mean that, your liver is healthy and safe. So, excess eating habits and no exercise, if you're a diabetes and if you have thyroid issues, and so all these things are multifactorial. And today we have grouped everything as metabolic syndrome. And these metabolic syndrome has equal effect for your liver, for your heart, and many vital organs in the body. And these people are more prone for coronary artery disease and equally prone to have fatty liver, which can convert into liver cirrhosis if not detected at an early stage. And how do you lead a healthy life? How to protect your liver is, see, any organ in the body needs good rest as well. So it all starts with your diet. So even if you have a fatty liver, the ultimate treatment is, I say to all my patients, is 60 to 70%. The remedy for fatty liver is your lifestyle. So we call that as a lifestyle modification. And 60 to 70% of lifestyle modification starts from your diet habits. You need to have a balanced diet, including all your micro and macronutrition. And in our country, in our part of the country, 90% what we eat is carbohydrates. So morning breakfast or night, your lunch in the afternoon or night dinner, in between snacks, it's all 90% of carbohydrates. And these excess carbohydrates are converted into fat and then gets deposited in the liver. So you need to have equal amount of proteins and then good amount of fibers and complex carbs rather than just simple carbs, because your rice, wheat is all simple carbs along with your sugars, whatever you add every day in your tea, coffee, or whatever drink you have. Now all these things needs to be, balanced out, because one cup of coffee can vary between 200 to 50 calories, and to burn that 100 calories you have to run for 20 minutes in a treadmill or an outside. So just imagine, then that means a single coffee or a couple of cookies can cost you about 100 calories to 200 calories. Then imagine what is the total amount of calories you'll be consuming, in a day. So on average, if you do a rough calculation, you'll be eating about 2,500 to 3,000 calories. And sometimes it is more than 60-70% of your recommended dietary allowance. And if you have a big dinner or this thing, then you end up eating 4,000 calories a day. But what you require for a normal sedentary lifestyle is only 1,500 to 1,800 kilocalories. And the rest, all the calories gets converted into fat and gets deposited in different parts of the body, starting from your blood vessel and then your abdomen, and in your back and in your liver. And that is why these disease starts. So a healthy diet is a must to begin with. And second is your exercise. You have to exercise at least for 15 to 20 minutes minimum a day, and up to 45 minutes is a good workout time. And nobody does that these days, because we don't even walk from point A to point B. Even if it is less than a kilometer, we always, tend to take a bike or a two-wheeler, four-wheeler, whatever it is. So the amount of walking has come down literally. So the maximum number of people I say is like, I hear is maximum distance they walk is from the car park to their office, and from the home to this thing, which is hardly even less than 500 meters at all. So the sedentary lifestyle is increasing, and the amount of high calorie food which you are intaking is also has increased, and the protein intake has come down, and your fiber is also very less. So weight loss itself, to begin with, 5 to 10% of your body weight loss can reduce your fatty liver up to 80 to 90%. And the medications which we give is fully rich in antioxidant, which is only like, it's just 20 to 30% of its job. And you can include a lot of food or in your diet which has rich antioxidants, like your spices and so many other food, like we can make it as a drink and have it, so that the antioxidants help in preventing this fatty liver, and also as a free radical clearance, and prevents coronary artery disease and other fat related disease in the body. And the second thing is about cancer. So today there is a rise of liver cancer, throughout the world. The incidence of liver cancer or a bile duct cancer is quite large. And for liver cancer, initially they don't have any kind of symptoms at all. Sometimes patient doesn't even have an abdominal pain or a jaundice, which we usually think. And most of them are incidentally detected for some other issue. They go, they get a screening done, and then they diagnosed to have a liver lesion and then a liver cancer. And today, liver cancer is curable. I mean, we have different varieties of treatment modalities for liver cancer, starting from for a very less tumor lesion of less than 2 centimeter, it can be without surgery by using this heat wave ablation or radio frequency ablation. We can just burn the tumor without a surgery if it is less than 2 centimeter. And certain tumors more than 2 centimeter can be embolized either with a TACE or a tear. And the third modality is surgery. If the liver is normal, there is no cirrhotic background for the liver, then you can remove a part of the liver. So God has created liver in such a way that it's divided into right or left, and even in that there are compartments. So if it is restricted to one compartment, we can safely remove it surgically. Or if it is spread in both the lobes, where it is, we call it locally advanced liver lesions, we can still go ahead and do a transplant for these kind of locally advanced liver tumor, where it is restricted only within the liver and is not spread beyond the liver. You can still go ahead and do a transplant. And the latest modality of therapy which is involved today is the immunotherapy, where every cancer we talk about immunotherapy. So the immunotherapy field, has completely revolutionized the cancer treatment, because it's not like the usual chemotherapy where you have so much of deleterious side effects to the body, hair loss, and all these things. That doesn't happen with immunotherapy. and it's very effective in controlling the tumor and also prevents the recurrence of tumor later when somebody has got a tumor recurrence after a liver surgery or a liver transplant. So even if you take liver cancer, there are two types of liver cancer which we speak about. One, the cancer is arising from the liver cell, and second is the cancer which is arising from the bile duct. So one, the bile duct entity is called the cholangiocarcinoma, and the liver cell entity is called an hepatocellular carcinoma. So both are very different in their characteristic and the way they present, their prognosis and survival. We can't treat both as the same. The most common is the liver cell cancer, and the second commonest one is the bile duct originating cells, which is called a cholangiocarcinoma. And nowadays, for all kind of liver cancer, we go for a multimodal approach. There's no only single form of treatment to increase the survival or to offer complete cure. So we start with chemo and immunotherapy, and then we contain the growth of the liver tumor by doing a TACE or a tear, that is called a trans-arterial chemoembolization or radioembolization, where every cancer cell has got a feeding blood vessel. So the cancer cell grows when it has adequate blood supply. So we selectively go into the liver like an angiogram through a cath lab procedure, and then we cut off all the blood supply to these tumor cells either by putting a TACE, that is a chemoembolization, or a more effective radioembolization where you put the radioactive beads into it and completely burn the, say, like a 5 centimeter tumor. We kill it. We just make all the liver cells die by cutting off the blood supply, so that locally you get control of the liver cells. That is one part of the cancer treatment. And second is, this is what we could see either in a CT scan or an ultrasound. And second is, there are always cancer cells in the blood which is not seen to the not visible to the naked eye. So that is the systemic part of the cancer treatment. So this is where your chemotherapy and immunotherapy comes into play. And then we give this chemotherapy along with immunotherapy depending upon what kind of cancer it is, either it is a bile duct origin or it is a liver cell origin. And then we choose the chemotherapy and immunotherapy. So this prevents further spreading of the tumor from liver to other organs or from one nodal station to the other lymph nodes, and then arrests it. And once we contain systemically and locally the spread of the liver cancer, then we give time. We observe the tumor over a period of time, how these agents are working. And in case if these agents are working beautifully, that means one, they prevent the progression of the disease further, and two, by shrinking the tumor itself, and third, we also see the tumor markers. So the common tumor markers are alpha fetoprotein, that is AFP, and CA19-9 is another tumor marker. We see the response to these therapy by the level of these tumor markers. Suppose, for example, if somebody starts with an AFP of 10,000 and after treatment if it is coming down to 5,000, 3,000, 2,000, and finally in few hundreds, that means the response is good. So these candidates have a good tumor biological activity. So that means they are not very hard to treat and their response to treatment is good. And this is where we put these patients under close observation for 3 to 6 months, depending upon whether it is a liver origin or a bile duct origin. And if they sustain the tumor growth for this period of time, then that is where your transplant comes into role. So by doing a transplant, we completely remove the diseased, the cancerous part of the organ. The entire liver is removed out along with all the nodes and everything, and then we put in a new liver so that it starts from the scratch. So that this is how the effective form of treatment, where you completely remove in toto the entire cancer cell origin, and then you have treated them enough so that all the micro things which your eye can't see, which is there in the blood, all these cancer cells are already taken care of chemo and immunotherapy. You do a transplant, so now it offers a complete completion of the treatment. This, you say, is a curative intent, intent to cure the disease. And then later you follow these tumors. Now, what is called a liquid biopsies. So we don't even have to do a biopsy directly. So the cell-free DNA or liquid biopsies are again a new modality of surveillance, where you take the blood sample and see the entire mutation analysis of every tumor. Even before these things come up in an organ, at the cellular level itself, you're able to know whether these tumors are coming back or not. And then you start the treatment for recurrence. That is, if this after a transplant also there is 6 months or a 1 year period, you keep repeating these kind of liquid biopsies in a frequent interval, set interval time. And when you suspect that, okay, these tumor cells might come back because there is a small rise or a flicker in the graph, then you start hitting them again with chemo and immunotherapy and kill them at their early stage. Nip it at the bit. That's what you generally nip it at the budding stage. That's what you generally say, right? So these are the advances which happens in the liver cancer treatment overall. So this is what this entire entity is called a transplant oncology, which is an emerging field, and everybody is talking about transplant oncology, where even if the liver tumor or any tumor is advanced, goes from one station to the other station, like one organ to another organ, we do this treatment locally and also systemically, and once it is under control, we can even replace or transplant both the organs as well. So this is a very interesting field which is developing in the last 5, 10 years, not even 10 years, last 5 years, everybody is talking only about this transplant oncology. It's a complete division. It's where multimodal treatment comes into place, including hepatologist, transplant surgeon, or a transplant hepatologist, a medical oncologist, and your surgical oncologist, and the radiation specialist. So all these different branches come together under one roof and discuss the best possible modality of treatment for a given situation, where you replace like for like organs, and then so that even people with advanced stage still has a hope for curative intent. So that is what the aim of every cancer cell is. And now the understanding of our cancer itself has totally changed, where now we have realized that every cancer happens because it's failure of your immune system. That's why somebody who smokes for 25 years doesn't have a cancer. Somebody who smokes for 10 years develop a cancer in early stage. So all because if your immunity is intact, your innate immunity is good, so that means your resistance to develop a cancer is very less. So it took so many years for the researchers to understand that cancer is a failure of immunity. So now how about replacing the immune system? How about improving the immune system? Next is a part of cellular therapy. So we can talk about a lot of things, exciting stuff, just for your knowledge, so that you also know that what is the advancement coming up in the science field. So we talk about these exosomes, natural killer cells, and dendritic cells, which are a part of our innate immunity. So these natural killer cells, in particular, are very important to guard your body. So if you have a cancer or any viral disease, that means your natural killer cells have failed. So a failed natural killer cells will lead to cancer. So now somebody's got a cancer. So I have done a chemotherapy, I've done an immunotherapy locally by using a tear or a TACE or a surgery. I have removed the cancer part. Still, why the cancer is coming back? So this is when everybody thought like, oh, so are we missing something? So we have given chemotherapy, we have taken the surgery and done it, but still cancer recurs after 1 year, 2 year, 3 year, 5 year, depending upon the patient's biology and how the body responds to it. So this made people to wonder and create something called natural killer cells infusion. So why don't we restore the immunity? So what the research is happening in this. So we take the exosomes of this, and after the completion of the treatment for a cancer by chemotherapy or a surgery, so now the patient is completely cured of cancer. So at this stage where the cellular therapy comes into play, where you try to restore your natural immunity so that the cancer cell doesn't come back. Even if it comes back at an early stage, these natural killer cells will go and fight and destroy it completely. So this is where the current research is going on, and we are hoping that after 10 years from now or 15 years from now, we'll have a complete cure for treatment by totally restoring your failed immune system, and you will have a cancer-free world. Not only for liver, for every cancer. A lot of research is going on. A lot of exciting results have come out, and this is how we're going to approach the cancer treatment in the near future. And we've talked enough about liver cancer and fatty liver. And let's talk about something called cirrhosis. And cirrhosis, like alcohol, is one part. And second is your non-alcoholic liver cirrhosis, where because of a sedentary lifestyle, even though you don't drink, you are obese, you are diabetic for 10 years, you have thyroid issues, you're not following a healthy lifestyle, very sedentary, you are overeating, your weight is increasing. So then you will have liver cirrhosis and end up in a transplant. And third set is the virus. So hepatitis B is there, hepatitis C is there, and hepatitis B and C are blood borne. You know, by exchanging needles and unsafe sex practices or to blood transfusion and any kind of sharing razors and needles, and all these people will have tendency to develop hepatitis B and C. So hepatitis B is got a vaccination where it can be preventable by using a vaccine. So it has been introduced in the immunization schedule for the last 20 years. So the current generation doesn't have a full protection about hepatitis B, and people who didn't have a vaccination still have a chance to get themselves vaccinated and prevent from hepatitis B. And that's why world over, the hepatitis B virus rate infection has come down. But now, on the other hand, hepatitis C is rising, not much in India, but in other countries, in Eastern Asian countries, hepatitis C population is quite huge. And these hepatitis B and C are not only they develop cirrhosis, but they also have a tendency to develop a cancer also. So and these are a set of patients where normally come to us for a transplant. So another thing I would like to share is not all cirrhotic patients need a transplant. So there are three stages of cirrhotics. So stage A, where you have a cirrhosis but no other decompensation, and stage B is intermediate, and stage C is it's more than the severe disease where definitely they need a transplant. So stage B, some people can go for an early transplant, some people still can wait for a transplant. So what are the signs what are the signs or what are the symptoms you decide somebody needs a transplant, somebody can wait? So one is the jaundice. And if your jaundice level is persistently more than 3, then it is one of the indication for liver transplant. Or when you have a lot of water on the tummy, there is ascites, water on the tummy, in the legs, not controlled with the diuretics which you take, or a salt restriction or a fluid restriction, still it keeps accumulating in large number, then ideally you should get a transplant. And second is people who have multiple episodes of blood vomiting or bleeding through your stools, when you have black color stools, more than 3 or 4 episodes, doesn't get controlled with your endoscopies and other your medication, then these people need a transplant. And fourth is, suppose if tummy fluid gets infected, it's called a spontaneous bacterial peritonitis. Then it needs to be, an indication for transplant as early as possible. Or your kidney started affecting because of your liver disease. It's called hepatic renal syndrome, the HRS. Then again, you qualify for a transplant. And fifth is somebody developing a suspicious cancer. Already there's a cancer in the cirrhotic background liver. And then again, those patients also need liver transplant. So these are the common indications where a patient needs a liver transplant if they have a cirrhosis. People who don't have these symptoms and they just have cirrhosis can still wait and closely follow up with the hepatologist to see when they need a transplant. And the other set is somebody's feeling extremely fatigued, they're not able to eat, they have a lot of muscle wasting. We call that as a malnourished sarcopenia. So we shouldn't let someone to go to that stage. So when somebody feels that I have cirrhosis, but I'm losing muscle mass, I'm not gaining weight. So these patients definitely need a transplant as early as possible, because when somebody labels you as malnourished sarcopenic, that means your success of liver transplant also comes down. So normally today the success of liver transplant is about 90 to 95% in major centers, and it keeps coming down when the patient is poorly maintained, he is not healthy, is not able to walk, is not taking adequate calories, he's got multiple infections in and out of ICU, and still there is no improvement despite trying all the medication for few months. So these are the patients need not wait until they reach the late stage. So a lot of people have a tendency to like, oh, okay, let me take it after 3 months, after 6 months, and then in that waiting period, they lose their health, and they come up after 1 year, 2 year, and very emaciated, only skin and bones. By then they would have had multiple infections. So all these patients we cannot promise more than 90% results. So it's always 80, 85%, because the risk of post-transplant infection is more. Sometimes these people won't do well after transplant because their body is already cachic sick. So when somebody reaches that stage of transplant, transplant should be done as early as possible. And that is the best way to achieve 90 to 95% of success in liver transplant. So and now, if somebody's got any doubts about liver disease, liver health, now is a time where we can have a discussion, or if you can just message, we'll be able to happy to help and answer your questions.
Sir, one question, sir. You just told that for onco, even some other organ is affected, so still we can revive by transplanting most of the organ. So what are the
Yeah.
organs?
See, it is not for, I said that part of multi-organ is not for liver cancer as of now, and it is only for a few cancer where we can say it's still in the nascent stage, where we can replace like for like organs, like neuroendocrine or a gastrointestinal stromal tumor, or if it is an appendicular adenocarcinoma, where we call it the jelly belly syndrome, the pseudomyxoma peritoniae. Only for 2, 3 diseases as of now, it is safe to do that multi-organ transplant. But we will be there soon once we develop the best immunotherapy therapeutical agents, where we know that okay, this is completely, we call the checkpoint inhibitors, where you can completely arrest it. So when we have such potent drugs, then these can be extrapolated from this cancer, which I mentioned, to other cancers like stomach, pancreas, and liver. But still at a very nascent stage, the due diligence needs to be done for these kind of tumors before we recommend these kind of procedures. And still, it's not a standard of practice. I just said it for us to have some hope for these patients someday.
Okay, sir. And just for my knowledge, if it's affecting lungs, the cancer is affecting lungs as well as the liver cancer, then lung transplant as well as liver transplant both are possible.
It is not currently recommended. Rather than a surgical possibility is always there, but it is not recommended because that means that liver cancer is very aggressive, that it has spread to the lung. So currently nobody in the world does such experiment. So it's not recommended.
Okay.
So I wouldn't
Okay,
do
sir.
it.
Thank you, sir. Thank you, sir.
Good evening, doctor.
Yeah.
We have a list of questions for you. The first question is, can liver damage be reversed?
Yes, like I said, fatty liver 100% can be reversed. Fibrosis to an early extent, there are 4 grades of fibrosis. Up to 2 or grade 3 can be reversed, but grade 3 and certain grade 3 and certain grade 4 can't be reversed. So because they already progressing to liver cirrhosis. So if we catch them at this stage 1 and fibrosis stage, early fibrosis stage, 100% it can be reversed. There's no doubt about it.
Okay. So another question is, how quickly can the liver regenerate after donation?
It starts regenerating from day 1 and it completes by 8 to 12 weeks, 95-98% of the liver regrows.
No. Is only alcohol the reason for liver cirrhosis?
Alcohol is the most commonest cause throughout the world, but now even in Western and our countries, non-alcoholic liver disease is catching up, and we call that as a emerging public health problem because diabetes, India being a diabetic capital of the world, hypertensive, obesity, poor lifestyle, and occasional drinking, occasional smoking. So all these things can affect the liver. And people who are teetotalers, no drinking, no smoking, but when they have all these in combination, like diabetes, hypothyroid, hypertension, overweight, definitely the chances of the liver getting affected is about more than 90%. And we see a lot of patients who land up with this for a liver transplant despite being a teetotaler. So that is very worrisome because people tend to ignore. People think that I don't drink, so my liver is healthy. So I can eat all the junk or whatever I want. I can still lead a sedentary lifestyle. I don't care. People just sit. I've seen so many people who are overweight, uncontrolled diabetes. They just sit, and when somebody finally forces them to go and get a liver check for some other reason, whatever, they go for a general checkup, then surprisingly they have cirrhosis, and they themselves are very shocked. Yeah. So this entity has been labeled as metabolic syndrome.
Yeah. So smoking can also affect liver.
Directly not, it can be one of the add-on factors. So there is no any direct correlation between smoking and liver scientifically as of now. But I mean, smoking can lead to other enough disease in the body. Just don't think that, okay, my liver is good, you can't smoke, so you can't take it like that. But another add-on factor, yes.
So if one is obese, that means that they have fatty liver naturally, or like?
Yes, yes.
So fatty liver can affect even the normal individuals who are not obese?
There is something called lean NASH. People even who are lean, if they have high cholesterol, high triglyceride level, they do have fatty liver disease. Because this entity came when people started working up liver donors for a transplant. So we always check the fat content when somebody is being worked up for a liver transplant as a donor. So then we realized that people even have a low BMI. That is, your body mass index is very low, is very lean, and still they have heavy fatty liver. That was very surprising. And then only this term called lean NASH came into the picture when we started screening normal BMI people for a prospective donor workup. So it is possible, yes, because the hereditary familial hypercholesterolemia, triglyceridemia, and all those things.
Is there any test particularly to identify fatty liver?
The only one test which is good enough to screen is the fibroscan. So rest everything is very unreliable. Ultrasound is there; it can give you a very and it's a very observer dependent. For somebody, it might look like a grade 1, and somebody it might look like a grade 2. Because grade 1 need not treat. So grade 1 it's okay to have a grade 1. So no, not everyone can have a pristine 0 fat level. Some amount of fat in the liver is okay, say like 10%, 12% is good. So beyond that, then it is considered as a risk factor for future problematic things.
Okay. So we have a lot of questions here. The time is less. Next we have what's the best diet to follow for healthy liver?
Yeah, so it's not only for liver, for entire body, you need to have a balanced diet. Because like I was mentioning in the beginning of the interview, 90% of our food is loaded with carbohydrates. And carbohydrates are the main culprit for all, it's mother of all, it's a culprit for all the disease in the body. So you need to have a balanced diet where you have a carbohydrates, and most of your carbs should be replaced with millets or a complex carbohydrates, like a lot of veggies are complex carbohydrates. And second is a good amount of 30 to 40% of lean protein mass. And then, you need 20% of fats as well. And you should include micro and macronutrition as well as in the food. So just watch out whatever you're putting in the mouth. Like I said, the calorie, it's very easy to have 4,000 to 5,000 calories every day, because a couple of cookies and one coffee can build up to 350 calories. And you need to work out 1 hour in the gym to burn 350 calories. It's not easy for people who are going to the gym to look at the calories and do, but just with 1 cup of coffee with sugar, you can just kill it. So all the excess calories gets converted into fat and deposited in the liver and your blood vessels and cause risk for heart attack and fatty liver to cirrhosis. All can happen with your excess calories. That's why we need to be more of calorie conscious. These days, even school kids, they don't drink the fizzy soda drink. I'm very surprised that the younger generations are more conscious in avoiding junk rather than the existing adults.
So how often do we need to get a liver test?
I mean, it depends on what is your risk category. Suppose if you're high risk, like you mentioned, you are multifactorial, then it's good to get your liver checked at least once a year, basic fibroscan. And when you increase your weight, say like, I was 80 kg, but in 6 months I have increased to 85 to 6 kg. At that time, you need to get all your blood tests done, including your lipids, that is your cholesterol, your sugar levels, and your fibroscan for your fatty liver.
So how shall one identify whether they have any liver problem?
I mean, liver is a very patient organ. It doesn't throw up symptoms just like that. When it throws symptoms, that means, it has exceeded its patient's level. And usually, fatty liver can cause mild fatigue and some kind of discomfort on the right upper quadrant where your liver is situated. We tend to oversee it because we tell ourselves that, oh, tonight I didn't sleep well. Oh, I didn't eat properly. I had a very long, tiring day. And we tend to ignore every day, telling that, oh, I didn't, that's why I'm a little tired. But a lot of people, when they come to me saying that, I've been tired, I've been lethargic, not able to concentrate, then we check, then we find a fatty liver, we treat, and then it gets cured. And that is not often the case. Only somebody who's very sensitive about the body, they come up to such symptoms, and then they get themselves checked very early. Other people just tend to ignore, and then they come to us only when it is too late. And other symptoms like jaundice and all, if there is an infectious cause for jaundice, then obviously, because you'll have fever, body pain, and then you get a blood test, then your bilirubin level is high. So that is a different entity. And alcoholic patients throwing up symptoms is, at an end stage. So by then, that means they're candidate for transplant. So it's very difficult to predict the liver symptoms at an early stage. Even if you have a liver cancer, you'll be fine.
So one has a question. Are there any basic tests for liver health?
The basic test for liver health, usually what everyone does is to get a liver function test, and which is useless in predicting it at an early stage. Because an early stage, liver function will be bang normal. That doesn't mean that liver is healthy. And second is a simple screening with an ultrasound, that is good enough. And if you want to go for a next tool, is that fibroscan. So these are the three tests which we basically recommend to screen liver disease: an ultrasound, the basic liver function test along with the coagulation profile, and the fibroscan. So these are like good enough to predict your liver health.
So how soon can one expect to retain complete liver health after transplant?
I mean, the recovery starts from day one. So after transplant, we make the patient walk from day one or day two. And most of them, they get discharged in between 10 to 14 days if it is a smooth post-operative course. And after a couple of months, they can lead a normal life, because the first 2 months there'll be an intense immunosuppressants where we advise them not to go in a crowded place, avoid talking to people who have cough, cold, and all those things. So after 2 months, generally people bounce back to their normal working style. Some people go take in 3 months, 4 months. It all depends on the individual and how the basic function of the liver settles down. So 2 to 3 months time is good enough for them to return to normalcy.
So how should the donor take care of his health after he donating the liver?
Yes. So after, I mean, see, donor can even forget that he did have donated his or her liver. But again, they should. One advice is like, after a donation, you should be a little more cautious when when you want to socially drink. But nowadays we are recommending that alcohol is not to be advocated, even because it is harmful and there's no any safe limit for alcohol. That's what we talked about also. Especially when you donated and all these things should be like, double or triple careful when it comes to drinking alcohol.
Okay. Then comes the other question. Can a person after liver transplant have to follow total diet restriction? And can this person occasionally have alcohol?
See, the Western literature do encourage and support certain amount of drinking pattern after transplant, but for Indian population, we don't recommend at all because people don't take your words as such. They always add some leeway to it and then they start drinking more. So we don't actually recommend alcohol in any form, especially after transplant. So as a generally, we don't recommend at all because it's very easy to fall back, and we don't recommend that. And all transplant patients, they can have a normal balanced nutritious diet. There's no any special diet, there's no any restriction. They can eat whatever they want, but again, like I said, it should be a balanced form.
Can any non-alcoholic people getting liver failure? How to avoid this and what's the reason?
I think it's the same question which I've been talking about. Non-alcoholic people is like it's all a lifestyle disorder. And if you are diabetes, you need to get your sugar levels under control, regularly follow up with your diet. Because I'm surprised to see a lot of people, despite knowing that they are diabetes, they come to HbA1c of 9 or 10. And when they ask, why didn't you see your doctor? They'll be like, oh, last 6 months they think that their sugar is under control. So that is really bad, and they start gradually gaining weight as well. So that is where they need to, rethink and reevaluate themselves and then see a doctor. So lifestyle is a major issue, even though you're not drinking alcohol. And people think that I'm not drinking alcohol, so my liver should be fine. So that's a misnomer.
What are the common risks and complications associated with liver transplant, if any?
It's a broad question. It's very difficult to answer everything under one roof. So, I mean, there are a lot of complications which can happen after transplant. One, the surgical related complications which can happen because of the surgical complexity involved in the liver transplant. As such, your arteries can get blocked. There can be a bile leak. There can be a stricture. There is again a array of. And after transplant, they are more prone for infection, especially how their condition. It all depends on how their previous condition is. Suppose if I said when somebody is very emaciated or somebody has got very malnourishment, sarcopenic, and these patients are more prone for infection the first 2 3 months of transplant. So they can go in for any kind of infection from bacterial to virus to fungal infection. And other is on a long run, patients can develop metabolic syndrome also because of the medications which they take for to prevent their rejection. The certain group of immunosuppressant drugs can actually lead to metabolic syndrome. So after transplant, after 6 months, we always ask our patients to keep a check on their weight because the weight gaining, it's a huge topic of interest, because the immunosuppressants which they take, be it a kidney, liver, heart, and lungs. So all these have a metabolic effect as well on the body after 1 year time. That is when they need to be more cautious and judicious about the calorie. They have to do a regular exercise. They can't afford to have sedentary lifestyle after transplant after 6 months. So like any other person, they need to, keep a vigil on their weight gain, dietary habits, and everything. The lifestyle basically.
So thank you so much, doctor. There's a lot of questions coming in, but I understand the time is less.
Yeah.
So any take-home message you would like to give this for Liver Day?
So my take-home message is, try to avoid alcohol as much as possible on different occasions. Don't keep it a regular habit of, oh, I have to drink once a week, I have to drink twice a month, or try to limit it and drink responsibly. And second is sound sleep and the stress-free environment. It's very easy for me to sit in here and say, like, be stress-free, have a sound sleep. But I know it's difficult. Even we also as doctors face a lot of stress And we also have sleepless nights. But as far as possible, even if you have 2, 3 sleepless nights, try to catch up that sleep whenever you can. And stress can affect your entire body system, not only your liver. It starts from your brain to your kidneys. It can affect anything. And the balanced diet. So always be conscious of what you put in your mouth. If you want to indulge in dessert, just tell that, okay, next 20 days, I'm not going to have any kind of dessert. I need to restrict my calories. I need to keep a watch on it and try to avoid organic sugar. Sugar in any form as much as possible. Once in a while, it's okay. And and also simple carbs. So don't eat simple carbs all 3 times a day. Try to mix and match with your millets or whatever your complex carbs from your veggies, and eat lot of veggies. Decrease your carbs so that your tummy feels full and you don't crave for that carbs again. And micro and macronutrition like selenium, magnesium, zinc are also very vital for the functioning of every enzyme or every cell in the body. It's very important. We don't pay much attention to that vitamin D, zinc, selenium, magnesium. So you need to find a balanced diet. Yeah. So, and good amount of water, 3 to 4 liters per day, is essential again to hydrate each and every cell of your body. And instead of drinking wine to make your skin glow, drink adequate water to make your skin glow. That is the easiest and the best possible way, because a lot of times I hear that red wine is good for skin. I want to shine, and even people go and take glutathione injections. But adequate amount of water, a good sound sleep, and a balanced diet cannot match any of your glutathiones or your wine to make your skin glow. This is my take-home message to people.
Thank you so
Sir,
much.
one question, sir. Sorry, sir. One question, sir. Last. Nowadays, social media is showing that some meal, 1 day meal per day, or intermediate fasting and all. So, if somebody is taking 1 day, 1 meal per day, or intermediate fasting, will it affect liver or not, sir?
See, it can metabolically, it can mess up your body. So I will put it this way: as you grow older, you don't need 3 or 4 meals a day. You can restrict your calorie, because when you are 40 plus and 50 plus, you don't need so much of calories, because you don't move around like you used to be when you are in 20s and 30s. So it all depends on how much calorie you are burning per day. Suppose you are a person, no, I walk 10,000 steps a day, so you can have 3 meals a day, because you tend to burn equally how much calorie you take. And my take on intermittent fasting is that the whole concept of intermittent fasting is to give adequate rest for your gut system. Okay. So that needs to be 12 hours is a decent time. I follow 12 hours every day. I don't eat, suppose if I have a late dinner at 10, so I don't have my breakfast till 10 in the next morning. So instead of having 14, 16 hours of intermittent fasting, you need to have 12 hours rest for your gut system. Your body needs that. Your gut needs that. That is, I would recommend that rather than going for 16 hours of fasting, 18 hours of fasting, and eating 1 meal or 2 meal a day. It depends on how sensitive your tummy is, because if you are fasting for more than 16 hours, some people will have sensitive tummy. They will have severe gastritis. They will have constant burps. So you are not recommended to have that. You can have 3 meals a day, and you equally space it and time it, and then give 12 hours of rest to your gut. That is most important rather than going for 12 plus hours of intermittent fasting. 12 hours is a good enough time, and every day everyone should follow that 12 hours of rest to your entire gut system. So this is my recommendation. This is what I follow also.
Thank
Thank you so much, sir. That was some great insights. And all the questions, we'll get back to that when you're available. We'll answer all those questions. So, yeah.
Thank you. Then I think the message is very clear, and thanks for listening. And I hope it was useful, and you gained a lot of knowledge about the advancement in science, as well as how to take care of your liver and stay healthy for the rest of your life. Thank you very much. Yeah.
you, sir.